right, everybody, welcome back to another episode of Body, Mind, Spirit. I am so excited because we have with us Dr. Paige Roberts. She is a sports psychology consultant and an energy optimization expert. Thank you so much, Paige, for being with us today.
I'm grateful to be here.
How did you get into this line of work? Because this is just fascinating.
Well, I had a lot of my own overuse injuries and sports injuries back when I was younger. And I was about 17 when I got into doing some of the altered state trauma reprocessing on myself. And it just kind of took off from there and wanting to help other athletes struggling from sports injuries and concussions as well.
And when you mean by trauma reprocessing, what does that actually mean?
Well, we know now that we can drop someone into the altered state of consciousness and go back through and reprocess fully and desensitize experiences within the nervous system. So it actually resets our nervous system to a calmer, more relaxed state, more parasympathetic nervous system state, if we can drop into the supramental, as we'd say with the altered state work, and allow for our whole matrix or our whole energy grid to be re-imprinted.
I love this because, and we kind of talked a little bit ahead of time, but like traditional medicine, we just kind of mentioned traditional medicine. Traditional medicine doesn't really make the connection between body, mind, and spirit.
No.
And this is something that I've learned myself as a traditionally trained doctor that I got to a point helping patients. I couldn't help them beyond the body because I wasn't trained in how to deal with that. But your background, you're able to address pretty much all aspects of wellness.
Well, most dis-ease comes from shock or trauma on the nervous system. So it's the undischarged shock that we're holding on to from a negative experience. And a traumatic experience is just anything that causes shock on the nervous system. So high levels of stress, failure, rejection, grief, loss, all of those things. So, yeah.
Yeah, so if this is sounding interesting to people, which I think everybody needs something like this, where do they start? And then I guess the other thing is, how does this relate with the sports aspect of things?
Well, really, we know, and we've known for a while with hypnotherapy, that we can drop someone in with sounds and tones and bilateral activation of the hemispheres. So you don't necessarily have to run out and start doing psychedelics to access these trauma memory networks within the nervous system. We can actually do that with sounds and that bilateral stimulation. And so I would highly recommend doing hypnotherapy or this other type of therapeutic technique called brain spotting before you jump right into doing some of the psychedelic work, because we still don't know really long-term what some of those substances can do to the brain. So that would be my first step for individuals. There's a lot of highly qualified people that do the hypnotherapy and brain spotting piece. So that's one part. And then the other aspect of things is it's really before the age of 12, we don't produce beta wave. So we don't really make sense and rationalize our experiences very well. So anything that's happened before the age of 12 is so much more traumatic on the nervous system. So it's going to be going back through your history and making a detailed list of all the negative things that have occurred and bringing that into your provider to be able to go through and reprocess, desensitize, and reimprint our nervous system.
What is the advantage of having the beta waves? And then how many different types of brain waves are there?
So we have the top end of our nervous system, which is our fight, flight, freeze, beta wave, sympathetic nervous system, right? So that's where we're rationalizing, reasoning, reacting to experience. And then we come down and drop into the middle, which is our alpha, our flow. And that's the brain wave that's optimal for recovery and healing. And then we have the bottom of our nervous system, and that's going to be more our theta, where we produce DHEA, where we recover fully, where we're sleeping, and that's more parasympathetic dominant, so the rest and recovery. And basically, with the beta wave, you'll see a child when they're being yelled at by a gymnastics coach or something, they just freeze. They don't really know how to make sense of it. They're trying to make sense of themselves in this world. And then anytime that's negative, language or some directive, like, oh, you're wrong, you're bad, something's not good with you, the child's nervous system is just sitting in shock and trying to make sense of it, but they can't really make sense of it, because with beta wave is where we really make sense of the world around us and compare ourselves to others in this world. So before 12, we have a really hard time of doing that. And that's why we start to see a lot of things come online as a teenager, more limbic, more middle brain, all that kind of emotional brain. But it's because you're starting to make sense of like, hey, was that reasonable that that coach told me I was, a piece of trash? When they're younger, kids just can't really make sense of that. So when it comes to the sports piece, we have to go back through and reprocess all of the negative experiences in sports, because what begins to happen is our nervous system starts to freeze on its own. So you'll hear about blocks or yips or balking, and we have to go back through the athlete's, list of their past negative experiences to fully reprocess and desensitize, so that they're able to have that fluid movement and not fall into that fight, flight, freeze mechanism, which is very unconscious. It's all sensory first. Like when it comes to an alpine skier, say they go down the course, they hit a patch of ice and they crash. Well, sensory wise, their body's going to remember that. So the next time that they start to skid in a similar way, their body will muscle guard and go into that fight, flight, freeze. So they lose their form. And so they start to slow down. They don't hit it as aggressively. They are then altered. So when I'm working with athletes, I can actually help them, speed up in races. I can help them have their fluid movement so that they're not muscle guarding at all unconsciously in that sensory perspective. And the American College of Sports Medicine just published an article talking about individuals, if they've had a sports injury prior, they're more susceptible, and particularly a concussion, they're more susceptible to tearing their ACL, because it's all sensory input outside of our conscious awareness. So we must drop into the unconscious or the altered state to release and clear these mechanisms, because they're all survival mechanisms, and then allow for the athlete to regain their full fluid movement. And it was really Dr. David Grand, a mentor of mine. I've been training under him for 12 years now, and he's the creator of brain spotting. And so he was the one that really started looking at this body arousal compared to the cognitive anxiety, because you'll have an athlete say that they're all ready for a competition, but their body is not communicating properly, and they don't have full control of their body. So in sports psychology, we separate body arousal and cognitive anxiety, and one can fuel the other. But in regular, clinical social work, with my master's is in social work, we don't really talk about the separation of the two. So Dr. David Grand was like, hey, let's combine somatic experience, EMDR. When we stimulate the eyes, we are triggering the cranial nerves and allowing for full reconnection of the nervous system. So that disconnect begins to happen when we have trauma. And then he added in the aspect of the focused mindfulness. So sitting in the experience itself and allowing for whatever aha or experience needs to come up associated with that negative body arousal.
It's interesting. It made me think back to the most recent Olympics, where there was some judgment by the general population on some of the athletes who basically pulled out of the competition because they said that their brain was not in the right mindset. For the most part, there was the media who was very supportive, but then I heard a lot of people behind the scenes like saying things like, well, they trained for this and they should be ready. But now it's making sense. And I'm like, your just explanation of it would have been like, oh, that makes sense.
And so what happens is when the pressure is on to perform, we go back through all of our trauma memory networks. We call it a target trauma. So when they're at a really high level, high stakes competition, you can lose even more control of your sensory input. And so, yes, so when an athlete is done because they are feeling that the risk of injury is higher than the reward. And so we need to really respect that. And we talk about respecting an athlete's decision to retire. And, I've worked with Olympic medalists at the highest level in snowboard halfpipe, which is very dangerous. And so really you're kind of trying to desensitize the nervous system to have no fear. But eventually these athletes, they'll sit on the fence of retiring for multiple years before they actually do, because they know that they have this 85% is all genetics at that level. And so they kind of feel guilty that they don't want to do it anymore because they know that they have this gift. But you really, when people are just like, oh, they just quit, it's like, they've been thinking about quitting for a while. And really, it's not completely quitting. It's just moving on to the next chapter of their life and their personal enjoyment. It's a job to these kids. And at the age of 10, we kind of know if someone's going to be a World Cup or even a D1 athlete. So it's all genetics. And so many parents don't want to hear that, but that is what is true.
This is great. And I can't wait to get into more of this when we come back from the commercial break.
The best things in life are the people we love, the places we've been, and the memories we've made along the way. Don't let your pelvic health get in the way of your life. The Pelvic Floor Store, your resource for personal health.
All right, so we are back with Dr. Paige Roberts, and this has been so fascinating. And I was thinking about the kind of the state of youth sports, because when I was growing up, it was like you just played youth sports to have fun, and now it's like the pressure that the coaches are putting on the kids and the parents are putting on the kids. And I'm wondering, from what you're saying, is like, are we really causing more trauma to these young athletes mentally at these young ages?
I absolutely think so. And, youth sports were developed for individuals to love sports throughout their life, to stay active. And so it seems like that's gotten completely forgotten at this point in time. And then when we're looking in the sports industry, most female sports are being coached by males, which is absolutely not appropriate either. So we've got that big issue going on. And then when we look at even just individuals within the sports industry, we've got females and BIPOC individuals being only 30% of the composition of those roles being fulfilled. So whether it be athletic trainer, coach, doctor, any of those pieces, or their primary medical doctor that's working with the team. So we've got an imbalance with some pieces, and I think that that's part of it. And then also we are training males and females the same, which is still wrong.
Yeah.
A female's body is entirely different than a male's body. So there's just a lot of pieces that need to be, taken care of, I guess, or like fixed. And then when it comes to just that shock and trauma on the nervous system, I would really empower parents to not allow for certain things to be done to their children. I think it's kind of shocking sometimes when a parent would bring a child in and we'd be doing the reprocessing. And oftentimes the parents want to sit in, especially if they're very young, and I'm totally fine with that. And they will sit there and hear that there were swear words being yelled at their 11-year-old. And they're like pretty shocked. And it's like, yeah, this is absolutely not okay, completely inappropriate. So yeah, there's a lot of issues, but I would really empower the parents to come together and hire a sports psychology consultant if they need someone to help them advocate. And I always called it sports mediation because I'm a mediator also, and going in and supporting my athletes or parents and talking to the club, because you have every right to do so. These are your children.
That gives a whole new spin. I'm so fascinated with that. But I also want to ask you about this energy piece that you do. And I'm not even quite sure how to ask about it. So I'm going to have you just explain it.
Yeah, so the reality is what we know with quantum physics anymore and neuroscience. Essentially, neuroscience is such a buzzword right now, and it kind of makes me laugh because it's really just the shifting of energy and how much energy is in the tissue, or how much light energy or biophotons are in the tissue. So I can actually do a QEEG brain scan. I use the Wabi device out of Boulder, Colorado, and I can show an individual after the 10 to 12 sessions that I typically recommend, about a 90-day treatment program, like anything else for the brain to become stable. I will show you that your voltage has increased in your brain and that your beta theta ratio has gone down. So you're not as spiking all the way up into that fight, flight, freeze, and then coming back down, fight, flight, freeze. You stay more consistent in that alpha flow state. And then also regionally throughout the 18 leads on the brain, we can see that you are reacting and communicating appropriately, not just hyperactive in certain areas. And that translates to reaction time. So we are actually decreasing someone's reaction time and their ability to make quicker decisions through doing this work. So this has been validated in, the most relevant, I guess, a QEEG is in the moment. of the brain patterns. So we know that that is, neuroscience based, right? This is real. And then there's other aspects beyond the altered state work is I use photobiomodulation light therapy. So it's the red and near-infrared light therapy pads. And we know that the near-infrared stimulates the mitochondria, which is very difficult to do. And we also know that it decreases the microglial priming so that the brain gets a minute to catch up, because the microglial go in there and try to clean up the brain, and they become overactive when there's inflammation. So sports concussions. So I really specialize in the sports concussion piece, because I find that if you are able to clear and desensitize, bring back blood flow, stimulate the mitochondria, an athlete will kind of go back to their default brain patterns before any of the stress or trauma or concussion. But we must go back through and reprocess and desensitize, because sensory wise, the brain continues to think that something is going to occur again. It doesn't make any sense sensory. But when the athlete lays their head down at night and there's the sensory input of the head on the pillow, it'll actually make it more difficult for the athlete to even sleep. So we see with sports concussions, 80% sleep disturbances. And that was really one of the primary things. My swim team school bus crashed when I was in high school. We were going to my first meet, growing up in the Rocky Mountains in Colorado, and I had sleep disturbances and no one could figure it out. And so it wasn't until I did the trauma reprocessing therapy that it allowed for me to rest and be able to sleep again. So it doesn't make sense, essentially. It's all just that sensory, like fight, flight, freeze, survival mechanism. But yeah, so we can show on these QEEGs a decrease in voltage, this beta theta ratio being very great, the lack of neurocommunication, the decreased reaction time regionally after a sports concussion and even just a sports injury, because it's Dr. Robert Scar. He's an MD neurologist. He just recently passed, very sad, but he has validated a lot of this trauma work in the trauma world as psychotherapists, clinicians, in saying that we don't know how to discern between a mental and an emotional trauma. We hold on to it the same way and react the same way, which is that shock reaction. So we must release and discharge that shock from the nervous system, and then you will reset your homeostasis to that calmer nervous system state.
Well, this is absolutely fascinating. And it's actually, I had recently went through a concussion, not related to sports, but it's fascinating because, like, my experience from an adult getting a concussion and in the traditional medicine system is being told, well, there's nothing you can do, just rest, don't watch TV, don't be on your computer, and and that was it. And I'm like, well, there's got to be something more. So this has been fascinating, especially since, especially in the sports area, concussions are happening all the time.
Mm-hmm. Yeah, it's we should not still be heading the soccer ball. We should not be tackling in practice. When they made that big shift from the college athletes not tackling anymore during practice, it was amazing, because I actually lost a friend in college to suicide, and he was the quarterback for my college team. And so they were still tackling during practice. And I absolutely think that had something to do with it. But yeah, if it was my child, I would not sign them up for some of these sports. I've been an alpine skier since I was 3 years old. And nowadays, I don't know if I'd want my child out there. It's like there were times I rung my bell that probably didn't serve me when it came to some of my ADD and being dyslexic and some of those pieces. It certainly didn't help. And so, yeah, it's really your decision of, later on in your life, what you want to, your brain health to look like, essentially.
I want to go back to when you were mentioning the word brain spotting, like this technique. Can you explain, like, what is brain spotting?
David Gran integrated in eye movement reprocessing desensitization, somatic experience. So finding that body arousal when you think about an experience, the focused mindfulness aspect, a little bit of the hypnotherapy aspect. So the bilateral sounds going back and forth and activating those hemispheres to get into the unconscious mind. And so David found that when we manipulate the visual path, we can actually find a reflexive cue associated with the story that we're talking about. And so we sit in this reflexive cue and have the individual go back through in as much detail as possible, whether it be silent and seeing and feeling it within their mind or speaking of it. It depends on how someone processes. Sometimes people process speaking a lot. Sometimes people don't process that way at all. So they'll just have to sit in silence. And so that's what David Grand's work was. And then I've taken the concepts and built on his philosophy and added in the alpha frequency. So the solfeggio energy
Yes.
medicine, essentially. So I have that with the bilateral sounds too, so that we are in training when we're going back through these negative experiences, we're in training the nervous system to stay in alpha all the time. So it doesn't peak up to the beta. So that's my current technique, is taking David's work and building on it, like science builds on science, and we keep evolving, which is amazing. And that's why I say my technique is really a sports psychology oriented technique, but Dr. David Grand's brain spotting is for any clinicians that are interested in doing this trauma reprocessing. And it's really funny in the psychotherapy world, because my undergrad's in exercise phys. So I always laughed about that, you know, people are still toting, you know, cognitive behavior therapy, trying to talk someone out of their emotions, trying to keep that undischarged trauma held in the nervous system, and doing the strengths-based empowerment perspective, because that's, you know, we're talking, that's a 50-year-old technique at this point in time. And I'm like, wow, well, brain spotting is about 20 years old. You know, like in regular sciences, you know, in hard science, it's like after 5 years, something's completely disproven. It's like we keep growing. So it's been kind of humorous to me in the social science world, where we are still just going back to something that's 50 years old. So I always tell people, it's like, well, I know this is kind of goofy. You're wearing these headphones, we're covering eyes, because one eye will have an experience with an experience that's entirely different than the other eye. They operate independently. So we're covering an eye, we're holding up pointers, we're doing all this stuff, and they're kind of laughing like, oh, this is goofy. It's like, well, I would rather have the most current knee replacement than the one that they're doing 50 years ago. So to me, it just all makes sense that we continue to evolve and understand these things. And then also with the psychedelic research that's coming around, it's that we, with the psychedelics, so it's allowing for us to really see that when we pop into this supramental aspect of our nervous system, that these memories just come up. And then once we go back through them and fully you know, make sense of them, essentially, if they happened before we created beta wave, our nervous system, we're just much more calmer in our daily life and having less mental illness symptoms. So I love that we have this whole psychedelic push going on right now, because it's just validating this altered state work. But like I said, we are able to access this just with sounds. So that supramental is what we call it. So yeah.
That is so fascinating. Is there, and wrapping up here, is there anything that I didn't ask you that you wanted us to know about?
I don't think so, outside of the fact that, like I said, I am really trying to get as many sports professionals trained in that. It's called alpha imprinting process, which, like I said, I've taken David's work and added another layer. And so I will be having that available in person, and then the online introductory courses for people, because I just love watching other clinicians be able to help athletes in the way that I've been able to over the last 10 years. So yeah.
I love this. This is fascinating. So where can people find out more information about you?
Oh, it's robertsneurotraining.com is my website. So yeah.
Awesome. So I'm just going to tell everybody, make sure you go check that website out. Tell, you know, if you're not a practitioner, tell your practitioners about this, because this is something they definitely need to know about. And after you check out that website, don't forget to go back to wytv7.org. Check out all our other programming. Don't forget to hit that donation button, because even $1 makes a difference. All money goes towards our scholarships, our community service outreach, and also bringing great programming like this today. So once again, Dr. Paige, thank you so much for being here.
Thank you.
And everybody, don't forget to tune in next week for another episode of Body, Mind, Spirit.